It's a good morning to you all. Welcome to Asake Online. My name is Zenzele and Nebele, and this is the Breakfast Club. Today, we are going to do this program differently. We are going to be discussing about the issue of COVID-19 and how local transmissions in Zimbabwe are on the rise. I think most of you could have heard or seen the statement from the Ministry of Health last night, which had quite alarming figures. And I know this is a topic that many people have different views about it. So talking to people about this, there are so many people with different ideas on what is going on. And I just thought probably we just need to have an open conversation about this issue of COVID-19 in Zimbabwe, in Bulawayo in particular. And we are live on Facebook, so you are able to comment on what you think if you are not able to join us. I also posted a link on my Facebook page, so you can actually follow up on what is going on. Join us, comment. You can come in through the program and have your say, because this is our responsibility. We only have one life, and we just have to talk about it. So to start with, yesterday, the Minister of Health actually released a statement saying that yesterday there were 273 cases. 13 of these cases were returnees. People are from, I think, 12 from South Africa, one from Mozambique. So that means 260 cases were local transmissions. What was also quite shocking, alarming. In Bulawayo, we had 231 cases. We know the 231 cases is a backlog of 7 days, but that is quite still high, because that means it's an average of about 33 cases a day. And so far in Zimbabwe, we now have 1,362 cases. 1,362 cases. We now have recorded 23 deaths. And in Bulawayo, we have about 419 cases. Most of these cases have actually gone up in the month of July. And a lot of people have been asking questions, which is why in July. Some people have conspiracy theories that maybe it is because people are talking about July 31, so the government is cooking figures to stop the July 31 demonstrations. And it could also be because somehow we have let our guard down after the lockdown. People can now move around thinking that the West is over. But because we're in the winter, the West is actually not over. So I have two gentlemen with me here, and if they are going to be able to internet allowing them or connections allowing them, also give them a chance to say their views about COVID where they are. But my worry talking to a lot of people here is we know our health system in Zimbabwe. We are not able to actually contain a lot of cases. So the best thing is with COVID, we just need to work together. We just need to stop the transmissions, because if we are all going to be admitted to the hospitals, we know that our health system is not going to manage that. But also, this is happening at a time when nurses are actually on strike, most of them demanding, protective clothing, salaries. So many of these institutions are manned by students on attachment, who also the health sector has also not been spared, because a large number of nurses are testing positive, and that means ordinarily when you get to a hospital, the nurses are going to try by all means to avoid you when they think that you have COVID, because they don't want to be in that situation. So what can be done? What are the measures that can be taken to actually make sure we protect our families, we protect ourselves? There's also been talk of people who are coming from South Africa via undesignated points, because they deliberately want to avoid the quarantine, the 31-day or 21-day quarantine. So what we have seen over the past few days is that some people will just, come in Zimbabwe and they don't go through quarantine. And the question is, as families, why are we doing that? Why are we allowing people who have not gone through the quarantine to come back into our community? We love them, they are people, but we also need to protect them. But also talking to health workers, doctors, and everyone else, there's also the fact that even if you talk about lockdown, you find that maybe there's a family that is someone in isolation, but you're told next door. Especially location where we don't have large areas, or abantwana bethu, they still interact. So we really don't do the lockdown as it is supposed to. But I have a few gentlemen here, and I'll start with the CDN. It's gonna where you are. What's the situation when it comes to COVID?
Ngisenkangala mina so far ngathi sesikulevuleke ukuthi sesiqalile ukubuyela ekuphileni kahle. So everything is getting back to normal, although you know this is a virus that you have to deal with it. So yeah, basically it's a UAE.
But kube kunjani ngesikhathi i-lockdown le khona? What was the situation? Bekuhamba njani? Manage njani ukuthi ikwanise ukuthi livule economy njani?
I-commitment nama-measurements that athethwe nguhulumende nabantu jikelele nomphakathi, regardless ukuthi umkhakha webhizinisi, just ukuthi libe negole eyi-one ukuthi lento ngoba ayikhethi mhlobo, noma usesihlalweni esiphezulu noma unemali awunamali, kuyafanana. So i-commitment ngasho ukuthi abantu bebe ne-one goal nokubambisana.
Yeah, Babundlovu laphana ulakho yini ongakwengeza laphana? Do you want to say something on this issue of COVID? Yeah, Undlovu laphana, I think network yakhe I hope we'll be able to catch him. But now Undlovu, you can come in and let us know where you are and what's going on. So the aim of this program is just to, it's a discussion. I just thought of my head that we just need to talk about COVID-19, and because I'm always in town every day, or I'm moving around. The attitude, I think first of all we need to change our attitude when it comes to COVID. Of course, there is George Masarira here. He's saying for nurses, they need to be paid, which is quite true, because our nurses are not paid, and they don't have protective clothing, most of them, and yet they are really in danger. And you find that we have had quite a number of nurses who have tested positive, and we need to do them a favor by making sure that where necessary, where possible, please stay at home. It's not, if you have no business in town, why are you going to town? But also what we are saying is that there are people who are coming from South Africa, who are coming from Botswana and other areas who are not going through the quarantine centers. So people just go via Beitbridge or designated points, and they come to Zimbabwe. They don't even know their status. And then these people come and mix and mingle with us, and we don't even know whether the person is spreading the virus, they have it and they don't. And the sad part about this virus is that asymptomatic, they spread the virus to others, but they won't be sick. So for families who are actually keeping relatives who are coming from other countries and not actually taking them to quarantine centers, I think you are being very irresponsible. I think you're actually putting yourselves in danger. You're putting your community in danger. And I think I've always, even the last time with the lockdown, we were just doing it because we are supposed to do it, but there were always complaints. People would say, and you find people, playing soccer, and all these kind of things. And my appeal to you guys is our health system is failing. We don't have a health system to talk about. And if you are going to have 1,000 cases in Bulawayo, all of them needing attention, look, since March, we have been talking about getting isolation centers ready. Up to now, Exilian is not yet ready. It's not admitting. So that means the first challenge that we're going to have is that we are not going to have enough facilities to take care of people who are sick. We stay in Western suburbs where you actually cannot self-isolate because probably you are renting a 2-room house with your family. So if one of us was to fall sick, or if the neighbor was to fall sick, or even the person or rental, how do we self-isolate in the Zamalogichi? So I think this thing needs us to change our attitudes. It needs us to then say, we have a problem. How can we address it? How can we make sure we deal with this? Uzanele Rapanuti is very sad with our situation. Our figures are the highest, and our death rate is high. Yes, it's true. Actually, death rates in Bulawayo is quite high. Brian says, as citizens, we don't need anyone to explain to us what COVID is so that we take it more serious. Wise people learn from others, people's experiences. I mean, Sonke, we watch news, we don't do social distancing. We aren't taking this thing serious, yet it's killing people. Our health system being messed up. We have to protect ourselves as much as we can. And I'm really not sure how much we need to emphasize this. I'm coming back to you. What can we do to change people's attitude? Because we still have people who think that COVID is a conspiracy theory.
The thing is, Chibelo, Lento, but most of the people, as I said earlier, that which I want to baggage but this thing is different from other viruses like AIDS, ukuthi ungabona ukuthi AIDS ngendlela abantu abayithatha ngakhona by the time ngene awuzange bayithatha serious. The only thing they could identify ukuthi ne-AIDS babesebethona ngo-identify ukuthi usule inwele seziphephuka, and we know ukuthi AIDS was a sexual transmitted disease, but compared to COVID, that thing is not sexual transmitted. You can get it just by contact. We understand that. So it is very dangerous, especially for people who are taking people from South Africa to Zimbabwe without papers, border jumping and all those kind of things. Imagine how many hours you spend from Busuga at Johannesburg to Siago Blawa. How many people you get contact with along the way until you get home. And this thing spread like wildfire. As you said, yesterday we had 200 and something cases. Trust me, by next week, you'll be recording like 600 cases per day. Where are you going to put all those people, especially in Nebele, isn't just Nakona Boblawa? So this thing is between you and me to protect each other. If ever there is a person otherwise which are being equalized, but I let the police, I let the and then things are done in a proper way. No, but that's very dangerous.
You're raising very valid points there. We have the government is paying the military and the police, ignoring vital areas of health and teachers. They're scared of the army's rule. The reason they give the army money at the expense of the health. Let me try. At the expense of the health, the problem is the government. Yes, I agree with you that government is not doing enough. But also now that we know that we actually don't have the health sector that is functional. We know we don't have medication. We know most of our nurses are not happy. Some have decided not to go to work because they'll tell you that why should I go and get COVID and then I get $2,000 bond a month? So I would rather stay home. So knowing that, very much fully aware that if you were to get admitted today, you might not even get a ventilator when you need it. What are we doing? Because it can only be us. It can only be ourselves who can, we can only save ourselves. We can only save ourselves. And so I know the economic situation might not be, there are people who are in the economic fringes in South Africa. You now need to come back home. And if that's the case, probably it is very important that you also, just go through the quarantine center, organize. Some people can actually organize for their quarantining in a place that is proper. Because what we have seen over the time is that people are complaining in these quarantine centers as well, but they are crowded. They spend a lot of time without actually getting attention. We did a story last night where we were talking to Abantabase Kumano. And people were saying, we have been there for 21 days. Then, and so people are complaining with our quarantine centers, they are not in good health. But let's face it, we have a problem. And if we have 231 cases in a day, Then imagine which these people are also spreading it before they are tested. You know, they also give it maybe even say a ratio of 1:1 or 1 or by 3. Before you know it, you're at 600. Before you know it, you're doubling that. From 600, you're moving to 1.2. Where are all these people going to go? You know, so Labokona, how have you, I mean, what's the situation now? Is the businesses open?
Everything is back to normal, but the thing is, you must put kids first. It's called a value. This has been completely cancelled in terms of schooling. They're more vulnerable when it comes to COVID. So other than that, my precautions, Gulandela, Kumendini, will go mask, safe distance, wash your hands, that's all. And then in the public, like Ubo Party, you can now go to the park, but those kind of places, Ama hall or restaurant, you check your temperature. Mount supermarkets, they provide with plastic gloves. Angithi amashop liyabamba amatamatisi check ukuthi right. So you transferring the virus without knowing. So all those kind of things, and then in the online grocery shopping, kuna deliveries, groceries, yabona. So everything is normal.
You know, when you're going to the shops, abantu bafika lapana kuma mango kuma tamatisi umuntu yabeloke bamba itamatisi lelani qede lichiye engathengi, you know, ngapha uyathimula ngesandla eqede bamba itamatisi lelani, you know, ama trolley wona lana esiwasebenzisayo, you know, there are so many people who use these trolleys. Then let me begin. So supermarkets can actually be, you know, that area where, you know, it's quite risky. So you are raising quite a valid point that probably when we get into the supermarkets, we need to wear, you know, plastic gloves or gloves, you know, gloves now, so that I don't take the gloves home. But it's really quite scary when you think of the supermarket that we go there every day to buy bread and and also the fact that we are, most of us, we go to the bank every day. You know, you go and queue a bank and we maliana, yeah, at least sometimes again when I'm the bank because they wear gloves. But if you think of all these things, we can see how much we are at risk. But also what worries me a lot is that most of us don't have accommodation is a problem in many urban areas. So we share facilities, we share bathrooms, we share, you're told maybe a family of 3 use the same house. And if other people don't practice hygiene, they are putting you in danger. So we really have a problem ahead of us. And if you are not careful, the next 30 days are going to be very problematic. We are going to see more people falling sick. We are going to see more people, being admitted. The next 30 days are going to be very problematic. We are going to see people falling sick. Your program? Yeah. Okay. Good morning.
Morning.
Reduce the volume.
The next 30 days are going to be very problematic.
Okay, and that's on my phone. Okay.
Yes.
So welcome to the program.
Yes, I'm going.
Yeah, Linja.
Nice corner, Bob.
Khona lina kunjani?
Hayi ngapha ngingathi ku right but sokwadlula but kuba lama pockets lapho okuba khona i-worry yami really ibikobulawayo kakhulu. Yeah, ngoba ngiyabona lokuthi nxa abantu besemabhasini laphana kuyaminyana, noma ezitolo kuyaminyana. So mbona ngazani thina ngokwethu abantu ngcono sizi-organize ukuthi hayi usingaminyani nxa silayina laphana ngoba vele ngaze iminyazeni yalene lawe asho ukuthi ngizangena kuqala ebhasini. So ngcono sizi-organize thina ngoba akulo okunye okuzasinceda.
Yeah, likhuluma into eqathekile uZupco. You know, most of the people now use uZupco lapha and it's crowded. What advice can you give to people? You know, before I come to you, comment yes, some say quarantine centers are even worse, risky because we cannot justify ukubaleka kwabantu okulwisa okubi ngokubi. So people are running away from quarantine centers. That's the major problem that we're having. Besides the behavior, we have a problem. We know the majority of people abakithi basurvive eGoli. But now and that means now you can't pay rent. Now people come home, but they don't want to go via quarantine centers. And I want to buy a join our communities without being tested.
Ngabona nxa abantu befika lapha kuma communities anje vele kuqala into ezinjengabondingindi labo bani sasi quarantine in a way ngoba abantu anje sasiba isolate. Ngangcono nxa abantu kubehlula ukuthi beye kuma quarantine centers lanxa bengekhaya ababendaweni yabo ba self isolate bengekhaya nxa befika within the community vele sibe kwazi ukuthi hayi umuntu akazibani vele eGoli kahlalise yedwa endlini yakhe yedwa njengakhona kwamanye amazwe khona ukuthi umuntu ebehleze endlini yedwa limfakela ukudla kwakhe eminyango azithathele ukudla kwakhe eminyango ngoba nxa bengazuza ukudla kuma quarantine centers vele bazabaleka.
Yeah, what you are raising is a very important point. Ama conditions kuma quarantine centers are not good, but at least we self isolate. But I mean, it's been very so good to they still have the luxury yokuthi be ema-club.
Yeah, yikho khona ukuthi asizwisisi kuhle ukuthi khona umkhuhlane lo unjani. Labo abantu bama club ngabe khathesi bayama mbijana ukuthi abantu begide e-club. It should actually be illegal ngokubona kwami ngoba lizagida njani e-club ngoba vele e-club kuminyene. Yabo noma emabhawa noma bona abantu ungcono umuntu bengamemukeli. Benxa bemathi vele eGoli kumuvela ngathi from wherever outside the country mubalekile ku quarantine center ungcono bangamemukeli within their community.
Yeah, in SA, self-isolation and quarantine worked initially because infection started in low-density areas. As soon as it went to high density, I think we need to improve quarantine centers so that people can see them as a place to go to. Abantu abasoze bebaleke emalokitshini amaroom we quarantine nga. So omunye uti no food kuma quarantines. That's why people run away.
Liqiniso civil, liqiniso. Njalo futhi khathesi asingeke sathi thina ama quarantine centers lawo they will be improved. Angiboni. Ngoba vele akula ncedo sizalithola towards that. So thina kumele sibe vigilant. Nxa ebalekile umuntu asim isolate ngikhaya. Although yabe sisho ukuthi khona ilokhuzeni maybe izindlu zethu isikhathi zincane njani but senza njani kathi nxa umntwana elendingindi umuntu elenye umkhuhlane omunye ogulayo othelelwanayo kungcono sizame nini khonokho ngoba sizaphela kobulayo sizaphela sibi.
You know, I'm actually even thinking that in most of lokishi amadala lawa we have hall, public hall. Maybe it's important. Maybe this is the time we need to engage a city council to say, can we turn our local hall into a quarantine center? You know, nxa ukuthi mina ngifikile then silungisa ama-hall lana, make sure they are warm, kuyafakwa ama-heater, then sengathatha umbheda wami, you know, ngizihambele ngiye quarantine ehholo laphana sikwazi ukuthi abantu bazabe bepheka bebuya ukudla bebuya lokudla, because what is clear is that we need to do something, and this something that we're talking about, we are not doing it. And what worries me is that I started covering into the COVID in March. And I know you've been following these things from the first time. Sivule kusileni ngale sikomplaina ngabantu ababengagqoka ama-gloves bekhulumela ku-microphone up to now. And that was March. And ekusileni is not functional. I'll just ngakubamba khonapho ngithi welcome to Bafana lapha who is just joined us. Bafana, can you hear us?
Yes, I'm interested in listening to the conversation as you proceed.
Okay, you don't have anything to say for now?
Not yet. I'm just entering now, so I want to listen to how the conversation has been going so that I can also put my contribution.
Okay, so nzabuya futhi kumama lapana ngithi up to now ekusile is not yet ready. So what is a very capacity to go Bulawayo to even quarantine, even to have about how many ICU beds do we have in Bulawayo? How many ventilators do we have in Bulawayo? So the fight is with us to actually make sure siyazigcina thina because i-virus ihamba labantu. Prevention is the best method for Bulawayo.
Kakhulu njalo ngiyathaba ipoint yakho le Ndebele yokuthi khona ama-community walls ethu maybe engaged council and work on that. I think that's a very good valid point here. Into engasiza kakhulu ngoba I mean kumele silwe kakhulu ukuthi abantu bengafiki ku state yokuthi sebesiya kuma ICU ngoba phela ezindaweni eziningi vele sokubonakala ukuthi ama ICU awancedi. So kumele concentrate really ku prevention la khona ukuthi khona ama community walls ethu abe ngizindawo ezokuthi zingayimukela abantu bathola ukudla. Ngibona zani that's a starting point really.
Yeah, so we basically, for those who are just joining us, we are talking about the issue of the rise of COVID cases in Bulawayo, and we now have over 419 cases. And the worry is that our behavior does not actually show that we want to stop this thing. So maybe the good thing was our lockdown came in early, and we really had a low cases up until at the beginning of July. That's when things started going north. And our attitudes need to change. Probably we need to think about ourselves. We don't have a government. That's one thing for sure. We have a government that doesn't care. We have people who will donate motorcycles rather than donating medicine and PE. So we have people who just decide and go and open mines when people are dying. And you're asking yourself, when the economy is closing. So we don't have a government. We are we were just orphans. So for Abantu Abangela health system, it is the only thing that will save us is our behavior. And currently, our behavior doesn't show that I know Abantu, they need to work. I know people need to eat, but where possible, let's social distance. He actually shook me when you talked about going to a supermarket, and you think twice about going to the supermarket. Most of the where people sell tomatoes, and those people
yeah, okunye ababekuqwayise ukuthi khona nxa sivela thenga izinto lapha ne supermarket vele sihle sizibeke zihle zigeziswe njengoba amatamatisi lama fruits vele ugezise with soap ngesepa sibili lamanzi into ezisemaphakethini amaphakethi lawana ageziswe kungakafakwa emafrijini kungakafakwa emakhabothini. Kuyethusa kakhulu into leyo ungayicabangisisa sibili ukuthi ukubamba nje into abantu bangaka abantu esifika sibamba kwampani into nxa sikhethe into esifuna ukuyithenga.
Yeah, because normally vele abantu bathanda ubamba bengakathi ubusilapana uthi anethi yena prevention and education is educational messages is the best in reducing infections. Some people get mild symptoms and babezibhotabhotela lapana behamba bethelela abanye they don't have symptoms at all, you know. Kulobaba lapana kulomunye ubaba umama but uGalaxy 8. Galaxy 8, welcome to the program. We are left with a few minutes before we wrap this up, but if you want something to say, you can say. No. Before that, let me just read this comment. The other thing is the issue of Zupo passes. Agula social distancing at all. Yet and yeah, we don't have a government. It's high time we do it ourselves. Abalanda balati. Hygiene want to be improved. No water. What can people do? So yeah, we know we have a crisis of water because of drought, but where possible, we have so many problems. But at the end of the day, we need to survive. So, Bob, I thinking about.
Yeah. Mozart, you came with a very good topic of what should we do, and you listed things that we do not have. I think that's the best way to start. If we tell each other the truth that we do not have anything, therefore we do not have anything to expect, therefore we can start success. But it's also a Zenzele program, and I'm a viewers, the listeners. First and foremost, Ibulawa you finally cleaning a mask. iqine ngama-mask ukuthi lama communities engavumeza abantu abahamba bengela ama-mask. The reason why siqina ngama-mask is ama-mask reduces 80% of the viral contact now omunye umuntu ekuthelela kumbe wena uthelwa ngomunye umuntu. Wena ngawugqoka imask nami ngigqoka imask, 90% of ubulawa igqoka imask, we can hold this in 3 months. That is a fact. Other countries have done that. The Czech Republic, look at the Czech Republic, about 300 something cases. Ngama mask wodwa. Right? Singaqina ngama mask. Siqina ngama mask ukuthi even lemchova kusela umuntu emthathayo engela mask. Singamele government isitshele.
Yeah.
Ezibhedlela kunamuntu ongenayo, even umuntu ekuchayela iround awungene egedini langikhaya ungagqoka nge-mask. Right?
Yeah.
Lokhu siyenze siqine ngani nge-self distancing. Right? Okwama 1 meter lokwana asikuyekeleni. 2 meters, 3 meters, 4 meters if it's possible. Ngoba laba sigijimelana kezani ukuminimize ngoba i-COVID lesingenile. Yiko ngiqalisele ngama-mask ukuthi ingangena abanye abantu abaningi. Right? Then sesidila manje labantu abasebenzuzile khathesi. We have to do something called symptom tracing. Abanye ama-countries la aphambili asebenzisa ama-app. Thina sila ama-app akhona Zenzele sila mali yama-app. So asisebenzeni konke esikwaziyo. Into esiyaziyo thina yibhuku lepen. Right? Ngiyangena mina ngumfana wemzilikazi always say ngiyangena mina ku-V3. Ugogo ku-V3 yagula. Right? Ngiyabhala phansi ama-symptoms akhe. Right? Ngihambe ngiyetshela yena lo i-leader ye-community kuvila bana ukuthi awugogo ngani khangani ngazwa kuhle la ngama-symptoms akhe. Siyabuya futhi kuseba sikhambe siyemcheck. It doesn't mean ukuthi umuntu wakhona ngifana ngisondelele eduze ukuthi enzele ukuthi ama-symptoms yikuyini. Right? Sesiwazi ama-symptoms ayi-COVID. The moment kuthiwa 1, 2, 3 symptoms, just think to yourself, it's COVID. Right? Kungcono ube le mistake kungaso COVID kuyi-flu than ukuthi kube yi-COVID when ucabanga ukuthi yi-flu. Right?
Yeah.
You touched on our community halls. We have to utilize into esilazo esatshela i-government kaSmith ngama-community halls ona lawa. Khathesi sesigcwele ama-church angasetshenziswayo asiwakhomodela ama-church lana yike sifaka khona abantu bethu. You touched on something. The reason why abantu bebaleka kuma-quarantine centers yikudla. Asinikekeni abantu bethu ukudla sibe nobuntu. Mina wamfaka ku-quarantine Zenzele unika ukudla unika ubuntu nami ngizabonke uyafuna ukunginceda.
Yeah.
So nami ngizahlala yona le 14 days even kuyi-18 days ngizayihlala ngoba njani ngilokudla kanti vele ngiyabe ngigijimelani. Right? Ngahlala khona phana lingaloke lingichecka libona ukuthi hayi lokho sokungani sokungcono yikho labe ngivumela khona ukuthi hayi linyekele ngihambe ngaphi ngibuyele ngikhaya kube endlini. Right? One thing we have to avoid quarantining ezindlini akusebenzi. Most of the cases that catch COVID-19 are people that you live with. So wena Zenzele ungabuya lapha ube layo uthelela wonke umuntu khona phana onjani ohlala laye. Yabona?
Yeah. Yeah.
Wena ungaphila kodwa ugogo wangeke ukuphila ngoba usanjani usaqinile.
Yeah, izolo laphana when I posted ukuthi there are 231 cases kobulawayo. Someone on Twitter actually told me ukuthi ifamily yakhe, I think it's a family of 9. They all tested. OCC, obhuti, omama labo baba, and it's a family of 9 that have tested positive. So I'm just about to conclude, but let me just look at my comments lab. Lo muntu othi asiyekeleni ukuvakatshelana at this time akufakathekanga, we can get in touch ngamafoni. Omunye uthi people don't want to put on masks emakhombini emabhasini, flea markets, yet the same people love speaking a lot. Then there's someone who's saying that as far as people would want a survival, which is equally important too, behavior change on our part will serve us as we do our daily routines. So we are talking, I think, in this Fanana Lapana, we need ama community outreach, abantu abakwazi okwaneleyo ngomkhuhlane lo, ama loudspeaker kwenziwe, so asebenzela ama loudspeaker kwenziwe izimemezelo, abantu ba ignorant. Let's educate abantu bakithi. Hygiene is very important. So I think we've already started that process. And if we can have a conversation, if be on daily basis, until it's it sinks engqondweni zabantu ukuthi every day let's talk about this. What can we do? How can we serve our people? What have you done wena in our community? And ukhuluma into eziqakathekile laphana ukuthi local, local level asikhangeleni, we just have to take care of ourselves because
ngingakaphumi mina nje ngicela ukukhuluma something that is very very important ukuthi singayistopa kathesi so we can reduce our numbers ezimfeni. Let's change our culture ukuhamba emfeni, right?
Yes.
Singasahambi emfeni. Mina ngabhujelwa yekelani ngihambe ngiyingcwaba umuntu wami labantu bama bayi3 lizabuya ingcwaba lihambi
kakhulu
guys, alihambi, right? Sisangcwaba abantu abaningi South Africa sibuya after 4 months 1 year kodwa lokhu ubuya khona phana ubuya ukhala khona phana ngathi umuntu okhona ufizolo, right? Asiyekeleni ukuhamba ukuhlangana emfeni lokwana esijayele ukuyenza, asikuyekeleni. Khathesi sigijimisa impilo, asimeni singastopa khona kwala reduce ngoba khathesi is all about minimizing. Sikhona iCovid, akusona umuntu ongakuphikisa ukuthi iCovid ayikho khathesi. Sikhona iCovid, asiminimizeni abantu abazagula ngoba siyakwasakula healthcare vele ekugcineni. If we keep that in mind, there is no healthcare, therefore avoid ukugula. Ngayithiya kona.
Hayi siyabo. Mama lingathini lapho sesicina?
Hayi khonokho ukukhulunywa sibili ngisekelana lakho. Asizinanzeleleni singabi sendaweni ezibunyeneyo sigeze izandla khonokho ukukhulunywa nguZethi kuliqiniso sibili kuliqiniso la khonokho ukukhulumileyo kwama community walls ngabe kule ndlela yokuthi abantu kufezeke kungasiza kakhulu.
Okay, so I think this time around, I would like to thank everyone who joined us and those who participated. I think for me, because interacting with a lot of people offline and online, I'm just scared with the attitude that there are some people about, it's a conspiracy theory. Do you want to say something?
Yes, thank you for giving me that opportunity. In short, I think most of the things has just been said. What kakhulu mina lapha engile concern khona kuma bus terminuses. I've been there lapho nxa ngiyabe ngene town. Indlela isiphithiphithi esiyabe sikhona khona phana, i-corona sesizivile ukuthi mhlawumbe isingaba transmitted airborne. So kuma bus terminuses mina ngibona nto sokungaba yi-hotspot khona phana. Ngibe sengisola kakhulu i-transport sector ukuthi why are they not allowing other transport guides to get in? It could bring a solution, not people to end up crowding as if we are in a rally or something like that. Mina really I'm concerned ngendaba nale. Even lasezitolo we have find ukuthi abantu we are queuing there, we are not social distancing, and anything can happen from there. So I think that's the opinion that I can give for now.
Yeah, I would like to thank everyone who joined us.
Just the last thing before you guys close, all I want to say is people stay at home. If you're in South Africa, stay in South Africa. If you're in Zimbabwe, stay in Zimbabwe. Don't transport calls. Transport. This is disaster. This is more than World War. People stay at home and stay safe. Thank you.
Yes, so the message is loud and clear, Lapanugut. We need to stay at home and if we're possible, and we need to stay safe. I mean, the only weapon that we have is ourselves. We have almost everyone agrees with the maybe Smith. We don't have a government. We have people who don't care. We have people who have no capacity to actually help us. We have been talking about isolation centers. We knew COVID was coming in December. We knew March when we had first cases and we had all sorts of interventions. And up to now, Excellent is not up and running. We don't have a lot of community. I mean, up to now, people are contributing to this. I mean, our government has done little to make sure that these centers are working. So as long as we have a high number of nurses testing positive, we are also going to have a problem. The only cue that we can have is to make sure that we prevent COVID from spreading. And it is me and you who can do that by constantly wearing a mask. religiously wearing a mask, washing our hands, avoiding going where is not necessary. I think for me, we will have this discussion almost every day, encouraging each other to make sure that we stay safe. My name is Zenzele Nebele. Till we meet again on Monday when we are talking COVID. Have a good weekend.